Hi there, my name is Mike Sullivan. I'm the Program Director of Valor Medical Services. I'd like to welcome you to this presentation from our series of continuing education for pre-hospital providers. Now, before we begin, there's a few things we need to go over. First off, the information presented in this program is intended for use by trained EMS providers. Also, due to variations in protocols and scope of practice among different states, departments, and agencies, this program may discuss or depict procedures, medications that are not acceptable in your daily use. If you see something in this presentation that varies from your agency's policy, always follow your department's protocols. Also, none of our authors or presenters of this program have any conflicts of interest or financial relationships they need to disclose. We do have documentation of this on file available in our office upon request. While we do our best to make sure that all the content we present is the most current available, participants are reminded that medicine is indeed a dynamic science and thus changes rapidly. So things may have changed since we've written or compiled this program. Please always follow the most up-to-date information available. In closing, if you have any questions about this or any of our other programs, please email us at info@valormed.net. Thank you very much and welcome to the program. Alrighty, now that we've got all that legal stuff out of the way, before we get started, let's talk about coffee for a second. If you're looking for a great cup of coffee, you probably want to check out coffeebrandcoffee.com. They're an online retailer, American owned and operated. They have a wide variety of coffees, teas, hot cocos, all sorts of different flavors. They've got all sorts of organic teas. You can get coffee in bean form, ground form, K-cups, whatever your heart desires. I've had several of the different blends and several of the different flavors. Absolutely fantastic. And because they are an American-owned small business, they don't have a big warehouse, so they don't have a big supermarket sales business. They roast it, they bag it, they ship it to you. It'll pretty much be some of the freshest stuff you'll ever get. Definitely highly recommend them. And they've got a promo code out for us now. If you use promo code VALOR SDS, you get a 5% discount off any order. So you can save a little money, try some fresh coffee, see what you like. They've always got different flavors coming through on their website. Some are permanent, some are limited time only. And if you look right there in the picture, you can see they've even got, yes, double caffeinated. Definitely a winner around this office. Alrighty, now let's get to class. Hi, my name is Mike Sullivan. I'm one of the instructors at Valor Medical Services. And in this program, we'll be discussing oxygenation. Now, we talk about the oxygenation based on the National Registry Objectives in 2016 edition. There are 3 core objectives we'll discuss. First of which, we'll analyze the physiology related to oxygen transport and metabolism within the body. Secondly, we'll discuss the American Heart Association guidelines on oxygen therapy for not only post-cardiac arrest, but also acute coronary syndrome or chest pain patients and stroke patients. Lastly, we'll discuss the role of free radicals and how they're related to oxygen therapy and how we can do our best to minimize this. Now, by definition, we know oxygenation is the process by which we get oxygen from the outside atmospheric air and get it all the way delivered to all the cells within our body. Each cell in our body requires oxygen to support aerobic metabolism within them. If the cells are unable to get enough oxygen or enough nutrients to maintain aerobic function, they will default over to what we know as anaerobic metabolism. Now, anaerobic metabolism is a backup or a default system. It's not a good system. It's not as efficient as aerobic metabolism, and it also results in a lot of waste products. These excess waste products can not only cause damage within the cells, shift the pH within the cells, but cause other damage down the line to the body as it has to deal with these waste products, these excess poisons that are generated. So, for us and for our patients, it's best that we oxygenate each cell as well as we possibly can. Now, when we look at how oxygenation occurs, it involves 2 primary body systems and at least one body system in a supportive or assisting role. The first system it revolves around is our respiratory or our pulmonary system. This is the system that's designed to get air in and out of the body and allows for gas exchange to occur in the lungs. We look at air coming in through the upper airway where it's warmed, moistened, and filtered. Any foreign material that we can, it gets caught up in either the cilia or in the mucus, and then it comes into the epiglottis. Once it's passing the epiglottis, it goes into the lower airway. We can think of the epiglottis as what directs the air down into the trachea, but yet keeps things from food, drinks, beverages, gum from going into the airway. It's sort of the split or the traffic control at the intersection of trachea and esophagus. Now, once air comes down into the lower airway, it works its way down to the carina, where the right and left main stem bronchi break off and go into the lungs. Once in the lungs, we find it at the alveoli. The alveoli are made up of small air sacs with semipermeable membranes, and these semipermeable membranes allow for gas exchange to occur. They allow the excess CO2 in the alveoli to get transferred over into the air, and at the same time, the oxygen in the air gets transferred over into the red blood cells. So that's sort of like the loading docks, where we load and unload the red blood cells so they can be sent back out. The second body system that's involved is the cardiovascular system. Now, the cardiovascular system is designed to pump and carry blood all throughout the body. It sends the oxygenated blood out to the cells and returns with CO2 and waste products. The cardiovascular system is made up of the heart, the blood vessels or vasculature, and the blood itself. This is our overall body-wide distribution network. As I mentioned earlier, we'll primarily be focusing on red blood cells. They're the big red boxcars that carry oxygen and fuel and nutrients out to the cells and bring back the CO2 and all the waste products to be disposed of. The last system we'll talk about is the musculoskeletal system. Now again, it's not in a primary role, it's much more of a supportive role. In some ways, it's going to assist the respiratory system. The ribs and intercostal muscles move out, the diaphragm moves down, and this is what creates a decreased pressure in the thoracic cavity, allowing us to suck air in. As the intercostal muscles relax and the diaphragm moves back up, this creates more pressure in the thoracic cavity, allowing air to be pushed out. Another way the musculoskeletal system will assist us is the cardiovascular system. The musculoskeletal system helps maintain what we call vascular tone or peripheral vascular resistance. That's the size of the vessels around the periphery throughout the body. These vessels need to maintain a certain tone in order to maintain blood pressure, thus supporting the circulatory system. If there's no vascular tone throughout the body, these vessels would greatly dilate, thus would drop our blood pressure significantly, and it would make it harder for blood to return back to preload the heart and make it harder for blood to get pumped out. Now, another thing we need to consider is the equation of ventilation versus cardiac output and how that will affect oxygenation. Now, cardiac output is the volume of blood that's put out by the heart over the time of 1 minute. So it's measured in mLs per minute. Now, the amount of cardiac output is based on two variables. Stroke volume, which is the amount of blood ejected from the heart each time it contracts, and the number of times it contracts in a minute, or the number of times it beats in a minute. When we look at stroke volume, it depends largely on what we call preload. Preload is how much blood is in the heart getting ready to be pumped. It also helps determine how much the heart muscle itself gets stretched. We know that the heart is a muscle, and based on Starling's law, the more the heart muscle is stretched, the greater force with which it will contract. We can often explain Starling's law of the heart based on that of a rubber band. A rubber band will contract much more aggressively if it's stretched further. On the other side of the coin, if the rubber band's not stretched much, it won't have a great deal of force when it contracts. So we need a good preload to the heart, not only to make sure we have plenty of blood to send out in that pump, but also to make sure that it's pumped out forcefully based on Starling's law. Now the second variable there is heart rate. It's pretty simple. We need to maintain an adequate number of heartbeats per minute. Typically in the adult, this is about 60 to 100. We call our normal heart rates. This is what makes up our cardiac output. Now, how does ventilation affect it? Well, when we inhale, we actually create a negative pressure in our thoracic cavity. Again, the diaphragm moves down, the ribs move out. This negative pressure causes inhalation and pulls air in through the upper airway. This negative pressure can also facilitate or make easier the venous return to the heart, because the venous return to the heart helps make sure we have adequate output. That venous return is what's needed to support our preload. And we've talked about how good preload is and how important it can be for us. So, now why is all this important? Well, if we're ventilating artificially, we're actually pushing air into the chest using positive pressure, as opposed to the negative pressure in the thoracic cavity that we usually get. This increase in the pressure inside the thoracic cavity may actually impede some of the venous return. This could lead to poor preloading. Excessive ventilation and not allowing good exhalation times can decrease cardiac output. If we're not getting good cardiac output out to all the vital organs, they will be inadequately perfused. When we look at ventilatory rates in an adult, typically we want to stay about 10 to 12. We've got the study cited there where ventilatory rates over 10 to 12 per minute are correlated to poor patient care outcomes. So therefore, yes, we want to ventilate the patient adequately and we want to oxygenate the patient adequately, but we don't want to overventilate, especially using positive pressure. Now, when we get into free radicals, what's a free radical? Well, it's a byproduct of a metabolism which are toxic to neighboring cells. These are frequently caused by excessive oxygenation, causing these free radicals to be released. By reintroducing high concentration of oxygen to either chest pain or ACS stroke patients, this may be more harmful to the patient based on the free radicals being released and damaging cells. Ideally, based on this, we need to use oxygen, but use it judiciously. Some of our goals in the AHA outlines: number 1, current guidelines recommend patients with suspected ACS or stroke not receive oxygen unless room air is less than 94% O2 sat. If you have a room air O2 sat of 95 or 96%, the patient probably won't need additional oxygen to supplement, unless the patient is complaining of dyspnea or shortness of breath, or if the patient has significant signs and symptoms of heart failure. In the case of significant heart failure, if 30 to 50% of their pulmonary surface area is full of fluid, they'll need the enriched oxygen in order to make up for that. However, we need to be judicious. We should start at about 2 liters per minute via nasal cannula, and we should titrate this up gently until we can get our O2 sat at least 94% and or relieve the other signs and symptoms above. Now, if you think about it, room air oxygen has 21%. At 2 liters per minute, we're increasing that from 21 to roughly 28%, 29%, depending which book you read. So it's actually getting 125% of the normal oxygen. So it's a pretty big increase if you think about it, even at only 2 liters per minute. As we get up, if we get to 3 liters a minute, we'd be at about 32%. Once again, a significant addition, a significant boost to what the body usually survives at 21%. So in closing, we know that every cell in the body requires oxygen to function, and getting oxygen out to the cells requires all these systems to work together properly. Overventilation, over-oxygenation can also be problematic, and therefore there is such thing as too much of a good thing, and we have to be a little bit careful. Hey there, I'd like to thank you all for stopping by, checking out our video. If you want more information about our company or any of the stuff we do, you can check out our website. If you need EMS continuing education hours, we do have our online education platform posted up there. Also, we have our email address if you have any questions. You can find us on YouTube, Facebook, Twitter, and Rumble. We maintain channels on all of those. Also, please like, share this out to your friends, subscribe, help support the channel, and we'll keep putting more videos out there for you. Oh well, enough about that. I know what I'm up for. Time for a cup of coffee. Y'all have a great day. Be safe out there. Bye.